today.
Hi there, and thank you for having me. I can't hear or see other people, so Sue, you'll be able to kind of moderate and make sure that everyone's hearing me okay and seeing me okay. I hope I'm not too washed out, but I hope to give some insightful angles on some hopefully not too controversial issues, but helping everyone really understand what's involved in healthy brain aging. And that's been sort of my interest for the last 30 years as a geriatrician with Valley Medical Group. I'm also with the Prospect Medical Group, and I'm with the Family of Caring, the old Van Dyke Manor in Ridgewood. Family of Caring is a post-acute and skilled nursing facility in Ridgewood, and I'm the medical director there as well. So off we go. So basically, the objectives of this talk is to talk about, brain aging and how it affects us in adult life. Also, to review medicines, hormones, and supplements that can be helpful or not helpful for dementia prevention. And all of those people who are sitting there wondering about Prevagen, that's my teaser. I will give you an answer, at least my opinion. The last component will be potential brain protection and what we all can do to have our brains age better and have healthy brain aging. And that would include stress reduction, physical conditioning, a healthy diet, and there are some diets that may or may not work, protective factors, and issues of mental stimulation. I just want to throw in some, I don't want to be a downer, but we are heading towards a world where 3 times as many people may have Alzheimer's disease by 2050. I know most of us on this, we won't be alive, but our children will be. And I think the researchers think that we could avoid this type of cataclysmic increase by addressing chronic health problems that give a greater risk for poor brain aging. That includes smoking, obesity, and high blood sugar. So in short, the best defense against Alzheimer's disease and most chronic aging diseases is to stop them before they begin, because we really don't have that many great treatments, and I will discuss those as well. So we really, if this talk boils down to anything, it's that a growing body of evidence is suggesting that lifestyle modifications that really include diet and exercise can potentially preserve your cognitive function and lower your risk of developing dementia, specifically Alzheimer's disease. So let's look back a little bit in time, and we know there's a lot of studies about various populations. One study that I do recommend, and if you want to look up this book, it's called Aging with Grace by Dr. Snowden. There was a collection of Indiana nuns who participated in this study. It was very interesting because we had their early autobiographies and we had tests of their memory performance. We also knew about their statements they made before they took their vows. And subsequently, they all donated their brains to science, and there was ability to review the pathophysiology and the autopsy findings of this group of women. And again, we know they all lived a similar lifestyle. We know they all ate similar foods. So what they found were 2 very important ideas or concepts. One is that 14 of the sisters who had Alzheimer's disease also had very poor cognitive function or lower cognitive ideas and low idea density, their grammatical complexity in early life. They were far more at risk for dementia. They also, as part of this study, not mentioned on this slide here, is they looked at the pathophysiology of those who had strokes. And the ones who had strokes ended up having worse cognitive findings later in life and were more prone to dementia. So if someone said to me right now, what's the best thing you could do to prevent Alzheimer's disease or dementia? I would say, 1, certainly try to be smarter when you're younger and get better educated. But 2, do everything possible to never get a stroke, because strokes become sort of the catalyst for worsening cognitive function if you're already on the trajectory to possibly getting dementia from Alzheimer's disease. So we know that there are a number of ways that the brain kind of misbehaves. And again, going back in time, some of you folks probably already know about some of this. We know that there's cerebral amyloid deposition, and that people who have a higher level of plaque can have what's called mild cognitive impairments, and that fewer or no plaques result in people being more intact. So as these plaques and tangles appear to accumulate and extend into parts of the brain, specifically the entorhinal cortex is one of the specific brain areas that by the third decade, we already know that if you're accumulating plaques and tangles, it's more likely that you will have the brain tissue deterioration that's most concerning for going on to getting dementia. So here's some brain pictures. We know that the amyloid plaques and the neurofibrillary tangles in Alzheimer's disease, that would be on the slide on our right. That's the one that, the left. That's the one that's not normal. And you can see that this isn't, a good thing to happen. Basically, these changes gunk up the works and make it harder for, harder for the call to go through. And it leads to dissociation of interrelated brain connections. And that's really what Alzheimer's disease is. Dementias are sometimes focal if it involves an area of the brain that's specifically damaged. But Alzheimer's disease goes throughout the brain and relates to how the brain's areas interrelate with each other. So it's basically a signal problem. Sometimes the call does go through. That's why Alzheimer's patients can have good days and be cognitive one way, and another day or another minute not be fine. And this is related to the fact that the diffuseness of the plaques and tangles affects the interrelation of the connections. And that's really the problem. Alzheimer's disease is a diffuse interbrain deterioration problem, not only a focal area of deterioration. So one of the areas that we see first is this hippocampus, which is this little seahorse. And you can see normals on the left, and the areas of moderate atrophy of our little seahorses getting smaller are on the right. And this is one of the first areas of atrophy and brain dysfunction that we can see on structural MRIs, magnetic resonance imaging. And there's a lot of research that is looking at different imaging and different early findings of this technology to help guide us as to what's really going on with dementia, specifically non-stroke dementias such as Alzheimer's disease. So what are we going to do about this? We got to stop and prevent dementia from starting in the first place. And there are many risks for brain impairment, one of which is hypertension. So basically, if we could control our blood pressure better, we could possibly decrease the risk of people. We may have 40 million people going up to 57 million people. Up to 153 million people with dementias in the next 3 decades. And so it really, this is a real problem, because in the United States alone, we could have 10.5 million people with Alzheimer's disease by 2050. So controlling blood pressure, hearing loss. Studies do support the fact that people who cannot hear well and have hearing impairment are affected cognitively as well. So working to identify and treat hearing loss. Depression. People who are depressed, and COVID and isolation has contributed to this, they too have difficulty. And with depression comes sleep. So people who are depressed and sleeping poorly have more likelihood to go on to have problems with cognition. The number one, though it's not listed as number one, but physical inactivity is a major problem, and it's easily reversed with more activity, and physical inactivity is another contributing factor for brain impairment. Social isolation, and then even air pollution. Studies show that communities that live in higher air polluted environments also have higher risks of possible dementia and cognitive impairments. So we can review also the protective factors for brain impairment, and then we can go on and discuss some practical things we all can do for brain fitness strategies. So back to why are we even going in this direction at all? That's because protecting intact neurons will be more feasible than repairing damaged ones. I have been in practice for 31 years at Valley, and I can tell you the same drugs that I was trained on in my fellowship to use for treating Alzheimer's disease are the same ones we have now. Literally in 30 years, 3 decades, we have not had a significant improvement in the treatments that are available to us. And that means we have to do a better job of preventing damaged neurons in the first place. So about 1/3 of accelerated brain aging stems from genetic factors. So that means 2/3 of what we can do on our own is modifiable. So the minimal risk and general value of a healthy lifestyle, and there's some recent studies out just within the last few months, argue that initiating strategies prior to, getting all these randomized trials to show how bad things are, but initiating strategies earlier to decrease the risk and protect our brain and our neurons is crucial to improving our likelihood of becoming demented later on. So this graph just shows you that, with the interventions, you're pushing out the curve. So in theory, you want more of your life to be lived with time, not cognitively impaired. And you want to maintain a higher level of your memory and your cognitive function longer before you go over the cliff. So what are the risk factors for brain impairment? Well, the biggest risk factor is age. Pretty much if you're over 65, you probably have a 1 in 10 chance of having a cognitive impairment. Once you break through into your 80s, unfortunately, it gets a lot more challenging, and you can go up to almost 50%. Family history of early dementia or strokes is not good for your risk factors. Having the ApoE gene, especially 2 sets, and other genes for early, there are genetic forms of early Alzheimer's disease. All these things are what we know as being definite risks. Possible risks are also important to consider because some of these might be modifiable. So head trauma, and we'll get into that in a minute, is not a good thing. There's an old saying about dementia pugilistica. So boxers, even soccer players who've been heading the ball, and people who repeatedly have had trauma. This is separate than the findings for the football players who have different type of head trauma, personality changes, and a whole different traumatic brain injury that's chronic. This is intermittent head trauma as a risk factor, lower educational achievement. Being chronically stressed is also problematic because that bathes the brain in cortisol. And the brain doesn't like to be bathed in fight or flight hormones, and that also contributes to problems with brain impairment. Alcohol, and we'll get to that in a minute as well. It used to be thinking that maybe 1 drink a night wasn't bad. Now we're not so sure. We even know that people who have even 1 drink a night can have some brain shrinkage. And certainly someone on blood thinners and someone with a history of atrial fibrillation, which in and of itself is also a risk for stroke and cognitive impairment, probably should really modify their alcohol intake. Finally, an unknown is COVID. We know there is COVID lungs. We know there's COVID heart. We know there's long COVID. We don't know yet whether or not there's COVID brain. There is some research going on now looking into that. On the subject of COVID, I just want to point out that there has been recent research that showed not only, and I'm sure you all know this, did more patients in nursing homes die, but more patients who had Alzheimer's disease related dementias died at a much higher percentage, even in the community setting, from COVID than people who are not demented. So what else is protective? Well, physical aerobic exercise is number one. If you get anything out of this talk, it will be go out and take a walk, because the more you exercise, the more you walk, the better your brain will be. And if it's good for your heart, most likely it'll be good for your brain, because the heart and the brain are integrally related. Anti-inflammatory drugs. Well, they've been studied, and unfortunately, not a home run, not even getting us on first base. Most of the anti-inflammatory drugs that have been studied have not been shown to significantly change or improve dementia progressions. And that includes non-steroidals, Advil, Motrin, everything else. Antioxidants, they've been studied, and we'll get into that in diet in a minute. There is some possible hope that trying to minimize, some of the oxidative things, but it's very hard to get that into your brain. So I wouldn't go out and start shopping for antioxidants as a way for brain protection. Low-fat diet, probably a yes, because it decreases the risk of heart disease. Mediterranean diet, another yes, especially later in life. Now, studies have looked at 50-year-olds eating Mediterranean diets, and pretty much none of them got any smarter. But the dietary studies do suggest that if you're eating a very healthy diet of fresh fruits and vegetables, and I'll get into that in a minute, these things might be brain boosting, and they might help stave off dementia. So just to throw it out there, walnuts might improve your cognitive function. Blueberries might boost your memory. And we're still researching whether or not fish oils, will be helpful. But certainly a low-fat diet, and I tell my patients who've heard this before, if you go into the supermarket, this we're going to get into diabetes in a second as well. If you go into the supermarket, you only shop in the periphery. You go to the fresh fruits and vegetables. That's where most of your shopping should occur. You can go in the back to the lean meats and fish, and you can go to the low-fat dairy. Everything in the aisles, everything in a package, everything in many in a can will kill you. I don't mean this lightly. I mean to just because we all got to eat everything, but you really want to focus on things that are outside of the aisles. And then when you pick up your item, you're going to look at the label and you're going to say, how many calories are derived from added sugar? If it's over 5 grams of sugar, you're looking at something that's probably not good for you, which makes it very difficult because we all like to eat a diet that is far more full of sugar than the diet that is restricted from added sugar. And then finally, we discussed minimal alcohol use. So we're going to go through these together, brain fitness strategies with medications, stress reduction, physical activity, lifestyle, diet, and mental activity. So medications. The most important thing to do with medications is take your blood pressure medicine, because having hypertension, especially untreated hypertension, getting mini strokes is bad for your brain and puts the brain at risk for cognitive impairment. Statins. What's interesting about statins is there's been no studies that found that just taking a statin, such as Lipitor or Torvastatin, prevents Alzheimer's disease. However, people who are at risk of stroke who are on these medicines, if you have fewer strokes, you're more likely not to have worsening cognitive function, and you're more likely to be able to maintain better brain health. We covered the non-steroidals. They don't really do much. Certainly do not take a lot of them, and certainly be very careful if you're on other interacting medications, and certainly let your doctor know if you're using them on a regular basis. So cholinesterase inhibitors are the current treatment for cognitive impairment of Alzheimer's disease. And that includes your rivastigmines and your donepezil, Aricept. What they don't do, and this has been tested, is they don't help a brain that's doing just fine. You can't like brain dope your brain by taking these medicines to get a better score on a test. That's been tried and it doesn't work. But these are our only set of medicines that help lower the progression of some of the behavioral symptoms of dementia that already exists. And it doesn't stop the process, but it helps patients possibly remain more functional for longer periods of time. The other thing to do is to avoid polypharmacy. Most patients that I treat are on probably 10, sometimes up to 15 medications. And it's not clear that all these medicines are doing them a world of good. I'm not saying any of them should be stopped abruptly, but you should discuss with your primary care physician whether or not all of the medicines you're on are necessary, and be very cognizant of the fact that medicines from an ophthalmologist might have other relations to your heart. Medicines from your allergist could affect your thinking or your memory. Medicines from other doctors could affect urination or bowel function. So it's really important to be attuned to the possibility that polypharmacy and too many medications can, one, they can contribute to falls, but two, they can also contribute to memory decline. But this is a conversation to have, with your doctor in the setting of your primary care or your visit to your neurologist. Finally, Aduhelm, the monoclonal antibody treatment that just came out and is a source of big controversy, is basically an experimental medication that was found to change some of the markers, those plaques and tangles. But none of the research actually was done to show any cognitive or functional change. This is sort of a wing and a prayer medication. No one wanted to not make it available because we have nothing else other than the cholinesterase inhibitors and Namenda. But in this setting, I would tell people you need to be involved with a university trial at a university medical center because there are serious side effects. We don't really know if there's a significant benefit. And it really should be under the auspices of experts who know what they're doing with this medication, which is an infusion. And it really isn't in the domain of sort of the community practitioner to have the expertise to use this. And I guide my patients to, dementia management settings such as Columbia Presbyterian Hospital, or even Mount Sinai. So that's the story on that medication. It's sad that our newest treatment, which also costs thousands of dollars to administer, may not actually do all that much outside of a clinical research environment. So let's talk about stress reduction. You guys are probably old enough to know what a cassette tape is. And this is an old cartoon that's showing, this is my relaxation tape. It's the sound of the ocean waves crashing onto shore and snatching my boss's body off his beach chair and carrying him out to sea. So anything that helps decrease your stress will be helpful to improve the aging process of your brain. We know that laboratory mice under chronic stress conditions have fewer of those hippocampal neurons, and they can have impaired memory compared with controls. So being chronically stressed out is not good. Anything you can do to try to be less stressed, and there are many different methods, and we'll get into some of them, but even taking a hike or a walk in the woods might turn out to be very beneficial for stress management, and may turn out to be very beneficial, one, because it's physical activity, two, because you're bathing yourself in nature, and that might be very good for your mood and your brain. Studies of humans have shown that several days of chronic cortisol exposure impairs memory performance, and chronic stress can cause depression or anxiety associated with impaired memory and concentration. So the bottom line here is, not just be angry or get rid of your mother-in-law. That's a joke. I do love mother-in-laws, and we have Mother's Day coming up. But in a non-joking way, anything that helps you decrease chronic stress is very important to help your brain age better. So one of the areas that I'm particularly interested in, and Valley offers some programs in this, it's called Mindfulness Meditation. Basically, it's a form of sort of non-religious, though religious meditation may be good as well, but it's sort of a ecumenical and type of meditation where you focus on your breathing, and studies are showing it can change the brains of ordinary people and possibly improve their overall health. And it's been studied that lower levels of markers of unhealthy inflammation in blood tests are one of the results of successful courses of adopting mindfulness meditation. And again, they can give you more information. Valley has a number of programs for pursuing mindfulness meditation. There's also many programs in the community setting as well. Physical activity is my number one area of interest because laboratory animals have more hippocampal cells. And we show that little seahorse. You don't want that little part of the brain to shrink. And being physically active is more likely to be associated with preservation of your brain function. Cardiovascular fitness is associated with less parietal, temporal, and frontal cortical tissue loss, less shrinkage of your brain. Physical activity in adults, physically active adults, have a much lower risk of Alzheimer's disease. So we've studied conditioning, and there are many different studies that have been part of this research. They've looked at healthy adults between the ages of 60 and 75. They put two groups into this study. One were doing aerobic walking 3 times a week. They built up from 10 to 40-minute sessions. So it's interesting. You don't need to be, an Ironman, running marathons, or going to the gym and pumping iron for hours. Aerobic walking, can be very successful at helping improve your brain aging. And then they looked at that with stretching and toning only. And what they basically found that mental tasks involving executive control, monitoring, scheduling, planning, and mental attention improved significantly. I'm not saying that the other exercises are not helpful, but the bottom line is if I had to pick one, I would probably err on the side of sustained aerobic exercise may be the most beneficial for brain health, but it doesn't mean there's not other good reasons for toning exercise, the use of weights, that's very helpful for osteoporosis, very helpful for muscle mass maintenance. And the takeaway from this is that if someone forces you to do an exercise and you hate it, you're probably not going to be helped by it. But if you enjoy your exercise, whether it's aerobic or weights, or even toning, stretching, Tai Chi, then it's good for you. What's the bottom line? Exercise, exercise, exercise. What are the other lifestyle choices we can make? Well, we can avoid head trauma. So loss of consciousness, even for over an hour, showed over time to have a 2-fold increased risk for Alzheimer's disease. So try to avoid, obviously all of us don't want to fall off our bikes, but falls, which is another area of geriatrics I have a particular interest in, avoiding falls and being, able to not bang your head up is very important, not only because it's avoiding breaking a bone and ending up with a serious complication of a fracture, but also you don't want to have head trauma, you don't want to have head contusions, and you don't want to have concussions. Soccer players have been studied, and they have significantly lower memory test scores compared with swimmers. So another reason not to stop playing soccer and heading the ball, but just to be aware that chronic head trauma isn't good. Midlife smoking. There's a lifestyle we all should encourage everyone to get rid of. It increases late life dementia risk. Now, the area of controversy. Previously, the thinking was that moderate alcohol was associated with lower dementia risk. We weren't exactly sure of the mechanism here. There's a lot of theories, one of which was moderate alcohol was associated with better eating, maybe it affected platelets. But There's been a recent study just now in Nature Communications that shows a significant link between even small amounts of alcohol and loss of brain volume. So we know your brain will get smaller on alcohol. We know that it can exacerbate atrial fibrillation. So as with everything else, everything in moderation, nothing to excess. And I would recommend looking at your alcohol intake and saying, do I really need to drink that much? Could I drink less? Certainly if you're on heart medications, certainly if you're on blood pressure medications, and certainly if you're on blood thinners, I think it's time to seriously reevaluate how much alcohol you use and whether or not you really want to continue at that level of alcohol intake. Moving on to diet. So we talked about the healthy brain diet, and the goal here is that, again, if you could prevent heart disease, high blood pressure, obesity, and diabetes, those conditions are related to cognitive decline. So the better we can do, and in particular, there are a couple of diets. There's the Mediterranean diet, the Mind diet. The bottom line is that if it's brown as a food, put it down. So breads, potatoes, starchy substances are more likely to give you calories in a way that may not be the best for brain aging. What you can do is have lots of fresh fruits and vegetables. Leafy greens have been shown to be helpful. The more colorful the fruits and vegetables are, usually the better it is for your brain. So that's associated with flavonoids, which are the natural substances found in colorful fruits, vegetables, chocolate, and this is back to wine as well. So people who were more likely to be eating those things, eating berries and sources of fiber and antioxidants, more likely had a better prognosis, and having more blueberries and strawberries has delayed the rate of cognitive decline possibly up to 2.5 years. So there's one thing for fresh fruits and vegetables. Now, other vitamin supplements pretty much don't work. They're probably, unless you were actually vitamin deficient, which is very hard to be on the American diet, for the most part, they're a waste of money, in my opinion. But fresh fruits and vegetables combined with fish, olive oil, and avoiding animal fats is probably a very good thing. And fish is brain food. And there are some studies associated with the whole likelihood that eating fish as a greater proportion of your diet is healthy for your brain. And then there's the low glycemic index carbohydrates, which I'll get to in 1 minute. But prior to that, I just want to put in a line about nuts and seeds are also associated with slower cognitive decline. So whole grains, lentils, soybeans are good for heart health and cognitive function. There are studies that show that people in Italy who had 3 servings of them per week, especially legumes, had a higher cognitive performance. So I would get rid of all of the expensive vitamins that are being sold on television, and I would put it into a healthy diet with more fresh fruits and vegetables, more fish, and more nuts and berries. Finally, carbohydrates. So there's a glycemic index that ranks foods from 0 to 100 based on the rate that the sugar goes up after you eat it. And diets that emphasize high glycemic indexes and those type of carbohydrates are associated with an increased risk for type 2 diabetes. I will even buy in. So the 2 things that have changed in my thinking over time are the following. 1, ending up with diet-associated diabetes from obesity and increased intake of both sugary and sweetened foods and less exercise probably increases the risk of poor brain health. And I think there is a group that is looking at what would be called type 3 diabetes, where is there a link between glycemic malfunction in the brain and dementia. A lot of this hasn't been proven yet, and a lot of research is going on right now, but I am inclined to be very concerned about the epidemic of diabetes and obesity in our population and the likelihood that these are contributing factors to poor brain aging. That also goes along with the theories about inflammation. I must say that I have become a inflammation believer, and I am concerned, just as chronic stress affects the brain, I think chronic inflammation can affect the brain. And in that way, the concern is that this type of problem, which can be associated with excess sugar and bathing the body in sugar and poor sugar metabolism, glycemic metabolism, this can also create a state of inflammation, another area that's being looked into regarding the connection between diet and brain aging. So just some quick examples of how to avoid ending up with foods that cause diabetes. We know back to all those colored and very brightly colored fruits, apples, apricots, cherries. There's a lower glycemic index, and then as you move through them, all the foods that really, do us in, French fries, pretzels, bagels. I love my bagels. How do you give up bagels? Dried dates, baguettes, and mashed potatoes. These are, foods that you really don't want to eat in excess, and that if you're eating things with more than those 5 grams of sugar, you certainly want to be eating much fewer amounts of them and have portion control. So as a part of this, there is studies going on to look at oxygen radical absorbency capacity, and this determines, how different foods counteract oxidative stress. And this is one of the areas where they're looking at how to protect the brain from damage from oxygen radicals, but it could easily be said that the brain could be protected from damage from inflammation and from chronic risks of diabetes. So as your antioxidant foods go, as your mother probably told you, prunes are good for you, and so on and so forth. But all of these are your top foods for trying to help protect your brain, possibly through this antioxidant effect. So prunes, raisins, blueberries, spinach, plums, and broccoli. Again, if it's brown, put it down. Eat colored foods. So dietary supplements, again, are probably a waste of money. E and C and multivitamins, there has been evidence for some protective effects, but, they're not definitive. The studies have been very soft. Very few have rigor and good data. And I'm not a big believer that nutraceuticals and dietary supplements are going to fix or help your brain aging. The other problem is many of these supplements are not fully regulated. And the problem there is that you don't know what you're really getting. So some of them have other components in their matrix that binds the pill together. And that could have things in it that you really don't want to be on. And then we know that other things interact with lots of things. Ginkgo, there was one very weak study of meta-analysis that showed some cognitive effects, but I would not recommend ginkgo. In fact, I wouldn't recommend any of the supplements. And now to answer that question that I'm sure is out there about the one on television, I'm having a memory moment. The problem with that substance is it is a protein that comes from jellyfish. No one knows if the substance in and of itself is even absorbed correctly because proteins are broken down in our stomachs. The second thing is I haven't seen that many brilliant jellyfish lately, nor have I seen jellyfish win Nobel Prizes. So the study that supports that substance being hawked on television is really a very limited study of a group of people that have reports of some type of cognitive function stability, but there's never been any controlled trials of this substance in a way that have shown that it is anything better than snake oil. So again, if you have, and sometimes those pills can cause $1 a pill for, I'm going to say the word, Prevagen. But it's likely that you'll be better off buying fresh fruits and vegetables, getting a gym membership, and being as physically active, maybe get a pass to a national parks and going and hiking, then you will benefit from taking that substance regularly. Finally, mental activity. There is the view, you use it or lose it. I have to say some of this is somewhat soft research, but some of it has some potentially positive and intriguing analyses. College graduates have a lower risk of dementia. In fact, people who have a higher level of education often manifest dementia were they to get it much later in life than they would if they weren't as well educated. So being highly educated is a good thing. Staying active and working with your book club, being active with your bridge club, being active with your societies that you have an interest in, the hobbyists, all the leisure activities involving mental effort are associated with a definite decreased risk of Alzheimer's disease. So it doesn't matter if you want to do crossword puzzles or Wordle, learn a new language, reading novels, using your right hand instead of your left hand, doing a maze or a jigsaw puzzle. Any of this is good. I don't think one is better than the other. The more you do, the better. I would go so far as to say that, unfortunately, because of COVID and social isolation, also the problem with social media, I would decrease your screen time, have more conversations, be more engaged with your peers, your colleagues, your fellow hobbyists. These things, assuming we don't get COVID from the social interaction, and that's a whole nother talk, these things are associated with much better brain aging. And I strongly recommend that the more active you can be. Now, going back to social media, as we're having this talk, through a virtual encounter, being associated with active virtual encounters is probably as good as meeting people in person. Though, if that's all we can do, then it's better than nothing. And anything that alleviates social isolation and includes interaction and emotional content is very helpful to avoiding depression, isolation, and the factors that worsen cognitive function over time. So there is a flip side to social media if it allows us to stay connected, and being well connected and having friends and having colleagues and interactions socially rather than being socially isolated is far better for promoting brain health than being in isolation. So back to the mental aerobics, any mental activity that exercises your brain. A lot of these concepts have been borrowed from physical fitness. Some experts suggest cross-training for the brain, similar to physical cross-training. Your right hemisphere is good for visual spatial tasks. If you want to take up painting, photography, go right ahead and do that. Left hemisphere, verbal tasks, learn a new language, work on your vocabulary, word puzzles, word games, they're all good. So I know there are going to be a lot of questions, and I do want to have some time to be as useful and helpful a resource as possible. Dr. Phillip currently is the Chief Science Officer of the Alzheimer's Drug Discovery Foundation, and he is my professor and mentor 30 years ago when I did my fellowship at Mount Sinai. And to quote my teacher, the best defense against Alzheimer's and other chronic diseases of aging is to stop the disease before it begins. This adds to the growing body of evidence that lifestyle modifications, including diet, exercise, can potentially help preserve cognitive function and lower the risk of Alzheimer's disease. So back to my little summaries: exercise, 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 and if the food is brown, put it down. So that ends our sort of formal part of this, and I know that we got a few questions out there, and I think that we will let Susan moderate the next component of our presentation.
That sounds great. Thank you so much, Dr. Leifer. I found myself taking pictures of some of your slides. Really very helpful. You know, I got to work on that memory, but I have the pictures. So good on technology. So that was wonderful. We do have a few questions. Somebody was asking about these brain changes and that you were discussing sort of in the beginning. Are any of them able to be seen via like an MRI or PET scan or anything like that?
Well, yes, there's actually now a number of research projects. It's not standard yet, though Valley does offer some of them. I myself am learning every day about them. There are fast MRIs and there are types of scans similar to PET scans where there are components that are taken up into active areas of the brain that show markers for different patterns. Some of those patterns are associated with Alzheimer's disease. So there is the beginning of research, and there's some scanning that's also in the breakthrough mode to assess for Parkinson's disease. So yes, there is a lot of high-tech research going on. I think it's a promising area that would be a component of assessments with likely neurologists or neuropsychiatrists and neuropsychologists for assessing different patterns and making associations, whether it might be prognostic for specific types of brain dysfunction, such as, say, Alzheimer's disease. For the most part, Alzheimer's disease is the garden variety, the bread and butter dementia that most of us see in our contemporaries and in society. It goes on over a course of 2 to 3 years to start, and then you look back and go, oh, you know, you're right. This was a slow, progressive cognitive impairment. If it's a stepwise, more precipitous cognitive impairment, that's more worrisome for strokes. And then if it's a very abrupt and short-lived, deterioration or quickly occurring, then you're much more concerned about very aggressive degenerative disease, such as Creutzfeldt-Jakob or other associated dementias. And there's a whole collection of them. There's frontotemporal dementias, Pick's disease. And again, that would be the domain of a neurologist. And again, sadly, we don't have many preventive measures for those types of dementias, nor do we have any real significant treatments. But back to the main question, yes, they are beginning to have tagged scans that show different areas of the brain lighting up in patterns that become pathognomonic for specific types of brain dysfunction.
Wow, wonderful. That's interesting. So somebody was asking, the emphasis on exercise and all of that, which is so important, physical exercise. What if you don't start until you're like mid-60s? Is that still a
great question? Actually, there is studies. So late life exercise, just as the reverse, midlife smoking is bad, late life exercise is very good. So I will tell you that it's never too late to start, working out regularly, going to a gym, working with a trainer, doing water aerobics. All these things have been associated with much, much better outcomes. In fact, even late life stopping smoking has been associated with better outcomes. So it's never too late, and that should never be the excuse to avoid. So one of those things, if someone worked very hard their whole life and brought up their family, but never had a chance to really get involved with formal exercise, even starting in retirement is a wonderful time. It could be something as simple as walking regularly with a friend or colleague, hiking in the woods, picking up pickleball, which is very popular out here, or platform tennis, all of these things. And those also have social components, which are very helpful, but be careful about the, after activity imbibing of alcoholic substances after tea time, so to speak. But for the most part, it's never too late, and everyone should jump on the bandwagon and exercise anytime in their life and as vigorously as possible. There is no specific amount of exercise that one would argue is the right number. I know we all have our Fitbits and our watches on, and we're watching our steps. The most important thing is studies do show just getting off our behinds, even for mild to moderate, for someone who wasn't exercising regularly, is probably even more valuable than someone who's going from moderate exercise to, say, a high level of athletic competition in that sport.
Yeah, the moderation really is we're realizing how important that is. I know somebody was just mentioning a question about that very thing, exercise being important, but unfortunately they're in a wheelchair. And just there are, though, I would imagine some exercises and movements that they can still do,
Yes, there certainly are exercise. In the good old days, Jack LaLanne, you guys probably even remember who he was because we're old enough to know. Yeah, chair exercise has been helpful. Water aerobics for people who are possibly limited in terms of weight bearing on their lower extremities. Many of the Ys have very good water aerobics, and some have specific types of pools that allow you to get from a chair into the water environment. But yes, chair exercises, it doesn't have to be necessarily even a hand exercise cycle is helpful. So all of those things, you just got to do something. You just can't sit all day. Sitting is bad and associated with bad brains.
Mm-hmm. What about the effects? I know you touched on this, the effects of like high blood cholesterol on brain activity. What are your
Well, there's no correlation with, per se, one specific level of cholesterol and one's risk of dementia or brain activity. But if your cholesterol is high and you have issues and your doctor's working with you about your cardiovascular disease risks, studies show that, again, preventing heart disease and stroke and general well-being of the cardiovascular system is associated with better brain health and less likelihood of progressive dementia. So I would follow your doctor's recommendation. I wouldn't say there's a correlation. You can't start a statin and then expect to have a brain that's going to jump 10 IQ points. That's not going to happen. But if you prevent strokes and prevent deterioration because of better general cardiovascular health, that includes exercise, decreasing the risk of obesity, decreasing the risk of diabetes, controlling your blood pressure, and lowering your cholesterol and decreasing your risk of cardiovascular and specifically heart disease and stroke, those things all together improve the likelihood that your brain over time will age better.
Great. So somebody is speaking about their parent, and they were talking about somebody who they're a little bit hesitant to take on some of the suggestions, accept some of the suggestions that you are making. Do you have any, like a typical older person, doesn't want to exercise, doesn't want to eat in a certain way, doesn't really want to adhere to a lot of what you're saying? Is there any way to approach this that you would suggest to family members?
If I could come up with this recipe, I would win the Nobel Prize myself. I think the question is something incremental. I think the worst thing to do is, as we get older, we're stubborn, we're set in our ways, and it's very hard to change behavior and change habits. So you pick one battle to fight. And if I had to pick one, it would be to get that person out and more active. And I would try to create inducements working on, is there a hobby they enjoy? Is there an interaction with family or grandchildren they want to have more of? And I would use that setting as my predominant level of motivation. I can tell you that complaining, haranguing, badgering, all those things never succeed. And the problem is, if someone is already beginning to be on the spectrum of dementia, to badger and to sort of antagonize them will only precipitate maybe some of the personality changes of the dementia, which sometimes come before even the cognitive function deteriorates. So you really want to create allies to help with motivation and pick one thing only and then focus on that one thing. They like to watch golf. Maybe they'd like to go to a driving range and take a few swings with a pro. They like to get up and maybe do some chair exercises. Well, maybe they'd want to go to a Tai Chi session. But you pick one thing and you try to find the sweet spot for motivating them and then try to push them on that one thing only. And again, positive rewards are far more effective in these settings than negative antagonism.
Wow, that is so that is, I wish I would have talked to you about 10 years ago with my own folks. But anyway, yeah, no, it's so true. Really like what you said. And I think also, I worked with a caregiver once, and I love the way she said this. She said, you know what, you do what you can do also. We can only control or assist someone so much, and so that always stuck with me.
Yes, I share that with my dementia patients in the outpatient setting. I always explain that, these types of progressive arguments only end one way, and that is the person who is demented stays alive while the person who's the caregiver ends up being exhausted and is the one who's more likely to have the problems as an exhausted caregiver. And I always try to explain to people, you won't win these battles. You have to redirect.
Yep. Wow. Yeah, so true. So I'm gonna just a couple more questions. Would you anything? Someone said something about sleep apnea increasing.
That's a great one. Sleep apnea. Sleep apnea is a risk for a number of serious problems. One is sudden death. So if you know someone who is experiencing snoring, poor daytime awakeness, daytime somnolence, not everyone who is overweight has sleep apnea, nor everyone with sleep apnea is overweight, but there is a body habitus associated with obesity and sleep apnea. But we have a whole center for sleep apnea studies at Valley, and it's integrated with the cardiopulmonary programs of the Valley Medical Group Health Network. And it's also been involved in atrial fibrillation assessment. So we have a number of extremely good assessments available for sleep apnea with Dr. Barish, who is the head of the sleep study program, as well as Dr. Salomon and people in the pulmonary group over at the Duck Pond building. So yes, I definitely recommend evaluations for sleep apnea. There isn't a direct correlation yet between sleep apnea and, say, dementia. We don't have a lot of studies on that I'm aware of, but we do have studies about sleep apnea and overall cardiovascular health. And since cardiovascular health is associated with cognitive function, it would make sense that there is a correlation through cardiovascular health that definitely sleep apnea is a worthwhile issue to be investigated and evaluated appropriately.
Yeah, absolutely. And just one final question. I guess there's so much information out there about diets that are heavy in legumes and grains and all those things that you were discussing before. Do you know of any studies that discusses those types of diets, the effect on brain impairment, like even a vegan diet or anything? Are you aware?
Well, the studies in general, there are a number of studies. There's a review of 22 studies about nut consumption in 44,000 people. They found that, if you eat more nuts, specifically walnuts, you're more likely to have a better brain outcome. They've looked at people who've eaten soybeans, lentils, legumes, and, again, the healthy heart studies. There is the Mediterranean and the Mind diets, which have strong links. I mean, there isn't one diet that I tell people, you have to enjoy life. You can't live like a monk. So you have to find things, and eating and food preparation and socialization are very much linked together. So you have to find collections of dietary interventions that you enjoy, not one to the excess or to the exclusion of others. So that I'm not telling people stop having an ice cream now and then, because what's life without ice cream? Really. But you can't have ice cream every night, and you can't have 5 drinks every night. And those are things that are not associated with good brain aging. So I would say that, look into the Mediterranean and the MIND diets. They have strong links to positive outcomes for successful aging in general and successful brain aging as well.
Great. And just one more comment. Somebody said something about, Prevagen and how do
I'm going to be taking the Prevagen people are going to come after me now.
No, but they were just saying, how does the FDA, how do they allow these
it's not FDA approved. So that's the problem. If you read the fine print on their packaging or look at the fine print on the commercial,
right,
these medicines are called nutraceuticals. So by being nutritional supplements, they avoid any of the requirements to be judged by the FDA to be efficacious and safe. So that's the problem. Nutritional supplements do not require the rigor that the FDA requires for drugs. So that's why I tell people look carefully at what caveat emptor, the buyer beware. Look carefully at what they're promoting and what they're touting, and be sure that what they say is going to happen is going to happen, because more often than not, when it comes to supplements and nutraceuticals, there is no significant rigorous studies supporting their use for brain health.
Right, right. Well, thank you so much, Dr.